There are many different reasons to avoid preterm labor. If preterm labor is not stopped, it can lead to preterm delivery. If a baby is born before the baby is fully ready to deal with the outside world, the baby may not make it, or the baby may be born with a lot of health issues. Hello and welcome back to Nurse Onye Teaches. My name is Onyinye. As you can tell by the title, in today's video, I am going to be discussing some of the causes of preterm labor. I've had a few moms reach out to me here recently wanting to know how they can either prevent it or stop it from recurring in their pregnancies. Worldwide, there is about a 12% occurrence of preterm labor. That means that approximately 1 out of every 10 mothers, or a little higher than 1 out of every 10 mothers, will experience preterm labor. Being a mother of 4 myself, I have dealt with it in 2 of my 4 pregnancies, 1 with a known cause and 1 without a known cause. It is important for women to know that there are so many different causes of preterm labor that it is virtually impossible to include all of them in one video and hold your interest. What I am going to do today is talk about the ones that women can reduce or change to help their pregnancies last up until full term. Now, if you are not doing so already, make sure you are working with a doctor or a healthcare provider who can address your particular needs, because what causes preterm labor in one woman may not cause it in another woman. Without further ado, let's get right in. So what exactly is preterm labor? Well, according to the Mayo Clinic, preterm labor is labor occurring after the 20th week of pregnancy, but before the completion of the 37th week of pregnancy. There are many different signs that a woman may experience in her body to clue her into the fact that she may be dealing with this. They include increase in the type or quantity of discharge that she is having, an increase in pelvic pressure, which is the baby putting pressure on the birth canal, any sort of back pain or abdominal cramping that is not accompanied with diarrhea. There are many different reasons to avoid preterm labor. If preterm labor is not stopped, it can lead to preterm delivery. If a baby is born before the baby is fully ready to deal with the outside world, the baby may not make it, or the baby may be born with a lot of health issues. The first identifiable cause of preterm labor is stress. Now, stress can affect a pregnant woman's body by changing the way her hormones communicate. It can affect your muscles. It can mess up your body's dynamics. It is very important to control stress. If your stress is from not eating healthy, make sure you check your diet and try to get a balanced meal on a daily basis. If it is from not getting enough sleep, make sure you are striving to get 7 to 8 hours of sleep. If you are someone who has a regular job or you have a lot of tasks to do at home, make sure you are getting help as much as possible. Or if you don't have any help, pace yourself, do what you can, and then sit down and pause. And as your pregnancy advances along, the chances that doing a little bit of activity can increase the level of stress you deal with is greater. So it is more important for you to really pace yourself as your abdomen begins to expand and grow. And then you can increase the chances that your pregnancy will follow through full term. The next treatable cause of preterm labor is infection. When a woman becomes pregnant, her immune system is slightly weakened so that her body does not reject the pregnancy. The problem with that is bacteria and fungi and viruses, which the body would have normally controlled in a non-pregnant body, now have a higher chance of leading to infection. It is very important for you to identify the cause of your infection before treating it. Now, I've had a lot of women come to me and ask about using herbs during pregnancy. I have a lot of videos up already about the use of herb during pregnancy, but keep in mind that herbs used at the medicinal rate also have the chance of affecting the pregnancy or leading to some not so favorable outcome in the growing baby. So before you use any herb to treat an infection or anything in your body, make sure you are talking with a doctor who has knowledge on how to use herbs before you proceed. A third identifiable and treatable cause of preterm labor is long-standing disease. Many women have conditions that they have battled with in their bodies long before they get pregnant. Some include heart disease, kidney function disease, fibroids, thyroid disease, among many other things. When you become pregnant, how your body deals with diseases can change. So it is very important that you are working with a doctor before you even get pregnant so that you learn how to manage your disease processes in your body. body. Now, once you become pregnant, you have to maybe work with a specialist who knows how to deal with those conditions in pregnancy so that they don't lead to preterm labor. Make sure you control these things so that you can carry your baby safely to full term. A fourth cause of preterm labor in a lot of women is how they manage weight during pregnancy. For some women, they do not gain enough weight. When your body is not getting enough weight to support pregnancy, it can lead to preterm labor. If you gain weight too quickly during pregnancy, it can also lead to preterm labor because those muscles and joints that support pregnancy are forced to expand too rapidly, and that can lead to irritation. It is very important during pregnancy for you to gain weight at a very steady rate. Your diet, the level of exercise you are getting come into play to help keep this balance in good dynamic. Make sure you are talking with your doctor on how many calories that you can take in a day so that you can properly apportion your meals. And then when you are exercising or doing your physical activities, make sure you are not overdoing it because that also can irritate those muscles and lead to preterm labor contractions. Keep in mind that it is suggested that women gain between 25 and 35 pounds during their entire pregnancy, depending on their needs. So you definitely have to pace yourself throughout the process so that you don't fall below or too far above this range. Now, last but certainly not least, some environmental factors can cause preterm labor. What I mean by environmental factors are some of the things that are located within a pregnant woman's immediate surroundings. Things like bleach or some of the other solvents that you used to clean your house before you became pregnant can now be irritating to the muscles and your lung tissue. When you breathe in these chemicals, they can really irritate your muscles, and those irritated muscles can cause preterm contractions. If you are a woman who works in an industry where there's a lot of chemical waste, you want to make sure you are talking with your headship or that you are communicating. You need to be careful so that you are not exposed to a lot of these chemicals. Another thing is smoking or exposure to secondhand smoke. It is very important for you to avoid this because smoke is a known irritant to the veins and to the arteries, which are your blood vessels. When these vessels are irritated, they can irritate the muscles that they supply, and irritated muscles tend to contract. Now, if you did not know, your uterus is a muscle. So a contracting muscle, such as the uterus, is the body experiencing preterm pain that it can avoid. Now, as previously mentioned, there are so many different other causes for preterm labor that I'm going to try to break them down into different segments in different videos. But make sure, most of all, that you are talking with your doctor so that he or she can point you in the right direction to cause your pregnancy to go to full term and you realize a healthy baby. If you have learned something in the content of this video, make sure to give it a like. Make sure you hit the subscribe button and do not fail to turn on your notification bell so that you know when a new video is uploaded. In next week's video, I am going to be discussing some of the foods that women can eat to increase their chances of conceiving. So if that is a topic of interest to you, make sure you stick around for it. And until the next video, be blessed.